And good afternoon. I'm Dan DeRose with 19 News, coming to you from our digital desk. And we have to report on something that we don't often report in Cuyahoga County, but we're seeing more and more of this throughout the country as people become a little bit leery of vaccinations. We do now have to report we have 2 confirmed cases of measles in Cuyahoga County. We have 1 probable case. Probable means there just needs to be a little bit more testing. All 3 of these children are from the same family. And from what we've been told by the Cuyahoga County Department of Health, is that the family traveled for the holidays. They traveled by car. That's very important because obviously they weren't in an airport if people were concerned. They won't tell us where they traveled because they don't want to reveal too much about the family. It might give away who it is. And of course, we're dealing with some HIPAA laws. We understand that. But we do know they traveled by car for the holidays. And we have 2 confirmed. It started out as 1 confirmed and 2 probable. We now have 2 confirmed and 1 probable. So we want to have a conversation about what this means and what families need to prepare for. So we're going to bring in Dr. Prakash Ganesh with the Cuyahoga County Department of Health. Doctor, thank you for joining us today. How are you?
Good, thank you. Thanks for having me.
Let's talk about this. Do we know how long it's been since Cuyahoga County has had confirmed cases of measles? A couple of years, 5 years? What are we looking at?
We had a confirmed case last year, just 1 case. It was isolated and didn't spread anymore, but just last year.
Okay, so it's not that far removed. Why, you're the doctor, you're the expert here. Why is this maybe a concern to you? Why is this a red flag?
I mean, I think it just goes to say that there's more outbreaks happening around the country, and with our holidays and the way we travel nowadays, it's easy for some of these diseases to spread rapidly.
And we do know, according to the Department of Health, has confirmed that these 3 children who all lived in the same household, so we're not talking about multiple families dealing with this. This was all 1 family with multiple children. All 3 were unvaccinated. We don't know why, according to the Department of Health, they weren't vaccinated, whether it was a religious choice, a family choice of not having these 3 children vaccinated. Doctor, when we start talking about the MMR vaccine, the measles, mumps, and rubella vaccine that has really been given for decades and decades now and proven to be not only effective but safe, when you hear an entire family has chosen, or at least these children were not given the vaccine and now they have measles, why is that a concern to you?
I mean, I think we've seen it throughout COVID, just the vaccine hesitancy and the misinformation and disinformation that has spread rapidly. And it's challenging to, it's scary for parents, and it's also scary for and hard for us to make that messaging clear for them. So I think it just goes to show that some of this information that is spreading can be harmful.
What do you want to tell people? What message do you want to get out about, and let's stick to the MMR vaccine. Let's not worry about COVID, the flu vaccine. What do you want people to know about the MMR vaccine?
The MMR vaccine has been around for several decades, as you mentioned. We've seen cases of measles drop rapidly with the introduction, and for the last 20 years, we had eliminated measles in the United States. It is coming back. We might be pulled off the elimination list because of the number of cases we've had now. But the MMR vaccine has proven to be very effective and safe, and we give it for children at 12 months of age and at 4 years of age.
I believe it is a 2-shot MMR, I believe is a dual vaccination. Let's talk about, is there a concern here for spread? You've got these 2, really more likely, we've probably got 3 cases of measles, all again within the same family. Are we worried about spread here?
I think with what the family has done, how they traveled, how they've engaged their medical providers, their doctors, and communicated with our amazing team at the health department, we've been able to isolate this family. And as far as I can tell, they've been doing everything they can be to make sure that they don't spread the infection.
Very important. Let's go through it. Obviously, you feel fairly certain there that this family is doing what they need to contain it to this just family household. Let's walk through what parents should look for. We're not saying specifically from this family, but what does measles do? Why is it such a concern?
Sure. I mean, from the onset, we haven't seen measles. A lot of doctors have not seen it, and so it's important for everybody, including the medical community, to know what to look out for. Usually, you have high fevers, even up to 104 degrees Fahrenheit. You'll have runny nose, sometimes red eyes, what we call conjunctivitis, and then a rash that develops that usually starts on the face and starts spreading downwards. It is a very infectious disease, one of the most in the world right now, and it could be easily prevented with the vaccine. Some of the long-term consequences could be pneumonia, what we call encephalitis, which can be inflammation of the brainstem, and can be very damaging long-term.
Wow. And to be noted, in very rare cases, it can lead to death, unfortunately. Dr. Ganesh, we're going to leave you, as we always do with our guests, with the final word here. I think the Cuyahoga County Department of Health is doing a great job by getting the word out here. What do you want to leave our viewers with? What do you want them to know?
If you are concerned, make sure you talk to your providers. If you are taking care of people who are elderly or have any immunocompromising conditions, make sure you talk to your providers to make sure that you are most protected and your family is.
Is there a cutoff that you were talking about the elderly there? Is there a cutoff, a time where we don't? You said that we're talking 12 to 18 months is when they get the MMR. Is it ever too late to get the MMR if you haven't been vaccinated?
Great question. I see patients in my practice, and I have elderly people who take care of their elderly parents and are concerned. So I do check titers for people and make sure that they have immunity to measles, mumps, rubella, and we vaccinate if needed.
Excellent. Dr. Ganesh with the Cuyahoga County Department of Health. We certainly appreciate the time here. Thanks for keeping us on top of the situation.
Thank you.
All right, take care, sir. That's going to wrap it up. Again, just a conversation that we wanted to have as this has come out from the Cuyahoga County Department of Health. One case of measles last year. We now have 2 confirmed, 1 probable. More than likely, we will have 3 confirmed cases, all from one family, a family who traveled by car. That's important. They weren't in airports. They weren't in a plane, potentially contaminating anyone else. They were all in the same car. They traveled for Christmas. They were exposed to another child with measles and brought it back to Cuyahoga County. So we'll keep our eye on this situation. Hopefully, as you heard from the doctor, the family can keep it contained to just that one household, and that's where it will stop. Again, if you have concerns about vaccines, highly encourage you to talk to your doctor. The doctors are the ones who have studied this, who have your family's best interest at heart, and they will be the ones that can guide you on that path. So if we have any other breaking news, it'll be right here on our digital platforms. Our noon news just wrapped up on Channel 19. Otherwise, we'll see you for 3.5 hours of news and first alert weather on Channel 19 at 3 o'clock. Until then, I'm Dan DeRose with 19 News. Have a great day.